Well, good morning. How are you doing today? Are you excited that it's almost end of January? Well, if you've not been affected by January, well, you're pretty much good. But all the same, thank you so much for joining us. This is My Doctor coming to you live on this 27th day of January 2020. I was about to say 2019, 2020. My name is Winnie Lubembe. As always, it's a pleasure to have you on board. Now, when we're hearing about palliative care, of course, the biggest question that people ask themselves is, does palliative care mean a person is dying? Well, for many years, people have spoken about palliative care and hospice care as though the two terms are synonymous, but guess what? They are very much different. And that, of course, is what we want to focus on today, that is on palliative care. But of course, we'll talk a little bit about hospice care as well, just to understand the difference between the two, who needs to go for palliative care as compared to hospice care, or vice versa. Or are there some people who do not qualify to go for the same? We'll stick around until the end of the show to understand that and much more on our discussion today that is on palliative care. And remember, we're live, so that means you can call in any time with your question as far as palliative care is concerned. The number to call through is 0791 478990, or better yet, send us a text message on 40920. We'll be looking at them a little bit later. But for now, my guests are here, of course, ready to answer all your questions and give us more insight on palliative care, because I want to understand this is a term that not so many of us know about or even understand or even know that there are centers that offer such services. So it's very, very good for you to stick around till the end of the show and get a better understanding as far as palliative care and hospice care is concerned. So let's meet our guests for today. Good morning, gentlemen.
Good morning.
Looking very good in black and in white.
Thank you.
But thank you so much for coming by today. We really appreciate your time. So before we get into the discussion, can we just introduce ourselves so that people know who you are and what you do? We'll start with you.
Yeah, good morning, everybody. My name is Ian Kimathi. I'm a nurse by profession. I've taken care of the old and the aged. I'm working with GoCare Health Solutions as the Director of Nursing Services.
All right.
Yeah.
Karibu sana.
Thank you.
And of course, on to you, Anthony.
Thank you. Yeah, good morning, everyone and our viewers. My name is Anthony Misheni. I work at GoCare Health Solutions Limited as an administrator, and what we do is that we provide home care services to the sick, the terminally ill, the elderly and the disabled, at the comfort of their homes here in Kenya.
All right.
Thank you.
Okay. Now, can we just start with the basics? Because you see, when we talk about palliative care, hospice care, seems like very huge terms for most of us to understand or even think about. So can we just start with the basics? Because now, today we'll be focusing more on palliative care. So can we just start with, I mean, what is it in a layman's language?
In layman's language, palliative care basically is any care that is given to a patient or someone who has been diagnosed with terminal illness, terminal illness, whereby the drugs they cannot be able to use drugs. That there is no more intervention. So that is where palliative comes in for such a patient. And as opposed to hospice care is whereby now when we have used the drugs and then they can no longer it is no longer effective. Yes, effective. So that is when we've stopped using the drugs, then that's when we render that hospice care useful for such a patient.
Okay.
Yes.
And you see, when we talk about, I mean, is one more on short term and the other one long term, or what brings about then the difference?
Yes, as you're saying, palliative care and more to it is normally to promote quality of life for the patient and also by extension the family. So it multidisciplinary kind of effort through various professionals to provide both medical, psychological, psychosocial, spiritual kind of support, which enhances quality of life, and also to reduce pain, discomfort, and side effects of the underlying conditions.
Okay.
Yes, as you're saying, the hospice care is more of a patient whom the doctor might have confirmed that due to the terminal illness, they are more likely to pass on within 6 or less months, within that time. So hospice care is more of quality of life towards the stages of final stages of life for a sick person who is terminally ill.
All right. And just in case someone is struggling to understand the aspect of quality of life, because I mean, at the end of the day, it's always said we should strive to ensure that we preserve the human dignity. And sometimes when someone has like a terminal illness or something like that, sometimes that's, I don't know if it's us, let's say the caregivers, or just in general, people don't really understand how important this is, especially during a person's last days of life. So can we just emphasize on that aspect of quality of life, and why is this important to this person as well?
Yeah, very true. It is very important to maintain dignity. We usually say in medicine that you should give quality care. Even if someone dies, they should have a dignified death. So it is important to have palliative comes in when we have when we are bringing this patient. We want this patient to have less symptoms, like to lessen pain. If you look at the family is going through a lot of the anticipating death. You know, it is especially in Africa. Death is a taboo.
Yeah, I mean, we don't talk about it.
We don't talk about it.
Or even plan.
Yes. So it is important because this family is going through a lot. They are anticipating death. So we usually give palliative care. It combines both drugs and psychological, just as my friend had alluded to. Yeah, it is spiritual. Spiritual to give the counseling, yes, to the family. Yes,
I like the aspect of it's a multidisciplinary kind of approach as compared to just focusing on medication and all of that. And of course, we'll talk about that a little bit later. But then again, so what determines what kind of service one gets in terms of, does this person go for palliative care or hospice care? What brings about the difference in terms of, oh, this one qualifies for hospice care as compared to palliative, or vice versa?
That will be determined by the at the stage of the condition, of the health or the illness that they're suffering. Of course, this illness, for you to be a candidate of palliative care or hospice care, you must have a life-threatening kind of an illness or life-limiting condition. And so, like for palliative care, the care can come in at any stage. At any stage.
Doesn't matter.
Yes. Even at the stage of diagnosis, palliative care can come in then because it's a process. And also, you see, especially for palliative care, it doesn't mean that when receiving palliative care, the other modes of treatment should stop for that. No, they can go hand in hand, So, but then for hospice care, of course, at this stage now, all signs should be showing that this person is towards their towards death or their final stages of life. As we said, either 6 months or less. Yes, so for palliative care, it can come in at any time once the illness is detected. But then for hospice care, it has to be when the doctor has confirmed that this person will live within 6 or less months.
Certain amount of, like has some certain amount of time to live. And that is like a sad thing to hear for anybody, and especially I can imagine for the family, where you're told your person, either your parent or relative, friend or anything like that has, let's say, 5 months to live. It's very difficult even for the person, I mean, and the family to deal with the same. But then again, why not then take care of this person, especially cases of terminal illness, and this person probably is told to have less than 6 months to live. Why not take care of them at home?
You can.
Okay.
You can.
All right. Okay.
Yes. It can also be done at home.
Yeah.
You can do it in various settings. You can do it in an hospital. You can do it in a nursing home. You can do it in assisted living facilities. You can do it anywhere, including at home. And it's happening. Like we told you earlier on, we specialize in home care.
Oh, yours is more on home care.
We specialize in home care, giving care to patients at home. And this we have patients who are receiving palliative care at home. So it can be done anywhere, in a institution setting, in a home setting, depending on what the family would prefer or what the patient would find comfortable and appreciate.
Okay.
Yes.
And I'm asking that in relation to, remember when we said, of course, when a family member is affected, we all get affected in one way or the other.
Yeah.
And when we keep this person at home, there's that pressure by the family members to ensure that this person is well taken care of. And sometimes that is not, it's almost difficult for most families because, well, you have to go and fend for your family, but then again, while you're there, you have to still think about this person. So there's a lot of stress, I would say, surrounding the same. So then what do you do to ensure that you alleviate sort of that aspect of stress so that this family doesn't have to think about taking care of their person as compared to taking them to a facility and having them taken care of there?
Okay, the best, that is the doctor, the patient's doctor who determines and who also gives the family the information about their. So usually bring in counselors to help the family. They also have caregivers, nurses who take care, who are specialists in taking care of these patients. Some of these illnesses, they cause a lot of pain. Like one example is cancer. Cancer, so we usually have a palliative care team, like palliative nurses who come with medications. If it's at home, they visit the patient and they are able to gauge the amount, the intensity of pain. We have a scale of 1 to 10. So depending on the stage of the disease, so that's this nurse can be able to assist this patient and as well as the family, because both the patient and the family are going through a lot. Yes,
you're right.
Yeah.
And so. So do you have, so let's just talk about how this works and then we'll talk about some of the conditions that would require a person to go for palliative care. So let's say, and can we talk about then different environments in terms of, let's say the family decides we want our family member to be at home, or others would prefer them to go to a certain facility and have them taken care of there. But then again, sending a person to a facility, I know there's some level of stigma that surrounds it because people think, oh, well, so I am going to die, so you don't want the burden, the aspect of burden. I think we'll address that as well. But for now, in terms of, let's say if a family decides, I want my loved one to be taken care of at home, what happens?
Okay. If as we said earlier on, the family, which primarily they are the next of kin of the patient, have the primary decision to decide when where care should happen. Like now, for example, in our case, I can maybe give a case of a case. What normally happens is that the family would make a request that they have this patient having this condition and they need this kind of care. So we go, we visit, we have a discussion with them, we get to understand the patient's conditions, we get to draw a plan, a plan for care, a plan that is comprehensive, touching on all their care requirements, as you said earlier on, medical care, psychosocial support, spiritual support, and then give them support at home. So this is a person who will have, as we were saying, people like counselors visiting them at home, medics going to see them at home, all this care happening at home.
Okay. So do we have like someone who is there, let's say, the entire day and night, if need be, or what happens? That is an area where we really want to understand.
Depending on the level of care required, you can have someone there giving care to them on a daily basis, either morning to evening, or evening to morning, or both day and night, depending on the level of care required. And also you also have what we call residential kind of care, whereby you have someone residing at their home 24 hours, provided them all the support that they require. Yes.
So it depends with the level
of care required.
Of care required. Okay. Then can we talk about that more in depth in terms of what then determines what level of care one gets? Does that make sense? All right.
Yeah. As I said, it is a doctor
Oh, so you work hand in hand with the doctor?
With the doctor,
Okay.
yes, yeah, because it is the doctor again who makes the diagnosis, yes, and informs the family. So we also help us decide what kind of care does this person need.
Require.
Yeah, require.
Okay,
Yeah,
all right.
yeah.
Now, can you talk about some of the conditions that might not necessarily have a person go to a facility, but just they can have still receive care, but more at home as compared to, or are there other conditions that one needs to go to, let's say, a facility as compared to being given care at home?
Yeah, like condition like cancer, chronic COPD, chronic obstructive pulmonary disease, yes,
HIV,
yes.
diseases like dementia, Alzheimer's disease,
yes.
Parkinson's diseases, yeah, that kind of diseases.
Okay,
yeah.
so that one is more on the facilities compared to
not really
to home care.
The
or
condition.
All of them require
yeah,
palliative care.
actually, what would qualify one to be in a home or a facility would be is the condition manageable at home. Yeah. So if a condition is not manageable at home, of course, they are to be in a facility. Yeah. For example, if the patient needs machines to use, they have to be in life-supporting machines, not able to be installed at home. Then they have to be in the home, in the facility kind of a setting. But then if a condition is manageable within the home setting, then regardless of the condition, the patient can be served at home.
Receive care at home.
Yeah.
Okay. Now, so then who is eligible for palliative care? And are there some people who are not eligible for the same?
Okay, people eligible for this palliative care is just people who have been diagnosed with terminally ill conditions. Yeah, so they can do that. We can have that care team coming to taking care of them. Basically, it is the doctor who decides who is eligible.
Okay.
Yes, and some of those conditions we've mentioned here. Yes. Yeah.
And now the biggest question that people always ask is then, does palliative care hasten death? Because you see, again, like we said when we started the show, sometimes we don't really understand the aspect of palliative care or hospice care. So when you mentioned that, especially an aspect of terminal illness and the condition not being manageable, let's say at home, people will think, oh, well, then this is just a way of probably
it may not like say it's to hasten death, because even if it's not palliative care, even if it's just a normal illness, you normally receive treatment, depending on what's needed to be treated and managed. So palliative care or hospice care would come in because the factors and the condition then require you to have it. So it's a form of treatment. That it's a form of treatment and care that is combining different aspects of care and treatment to make you have a more quality of life because of the illness, and also maybe ease things like pain, as we said earlier on. So the notion of the wording, the palliative care, that yes, you might as a human being you might feel no, I'm going, I'm dying, and all that. You might have that feeling, but then palliative care is a positive thing, something that is something that is positive, because even if you don't receive palliative care or hospice care, if you require it at that time, the condition is not changing. If in any case, it might be deteriorating. In any case, so it's a way of care at that stage of life or illness that is useful and good for the patient and also the family.
Okay. Now, can we handle then that aspect of stigma? Because like we said, sometimes when, and especially this is when someone is taken to a facility as compared to having someone to come and help take care of a loved one at home, that aspect of stigma, they will be like, yeah, so these people don't even like they don't love their family member. That is why they are sending them away. That is the thing that people say all the time. You're sending them away to a facility where they can die peacefully. I've heard people say that. So then can we just make it clear for people to understand why even this is important and it should not be considered as this family does not like their loved one, so they're sending them away to die peacefully?
Yeah, as I said, palliative care is more, especially in Western countries.
Yeah, it's common there. We hear a lot of that there.
Yeah, but in Kenya, still the stigma is still high, but the good thing is that the doctor will say the truth, that this patient is not going to live for the next six months. So what we do is the society should be able to embrace the palliative care, because sometimes actually it is inevitable, such illnesses. Yeah, because the disease stages, there are some of these diseases that they get to the final stages, that whereby
it
no
progresses
amount,
really quickly.
really quickly. There is no amount of medicine that can. So palliative care comes in to promote that comfort, to bridge in the gap between death and those who are living. At least to help them go through that period, because it's a very very bad period.
It is. Plus, it might be very difficult. And in terms of, like we said earlier on, for the family as well, it can be really difficult.
Yes.
Because sometimes you don't know what to do in terms of helping this person. If it's pain, to ease their pain. If it's that psychosocial support, we don't know how or what to say. Because sometimes we think, oh, well, we might say this, and then this person feels some type of way. So we're trying to be really careful in terms of handling this person. And like we said, it can be really difficult for the family member to just be there without having to worry what the person is thinking. How will they feel? Do they feel neglected? Do they feel they're not being helped? Because sometimes we don't know how to help. We're not professionals.
Maybe in our African culture, and I think this is what we've seen even from our experience with now providing care at home and all that. We, as you said earlier on, the aspect of like in the Western countries, you find them sending people in care facilities, in nursing home, and they die there and all that. But then in our African culture, I think one of the flaws of our African culture is that I found that there's a love culture in families. There's a love culture in families, and when a loved one is suffering, you won't find families sending someone away. Maybe for them to be treated somewhere, or for them maybe to die in a peaceful place somewhere. You'll find people will go out of their way to help their loved ones, and also provide the necessary care within the home setting. So that thing of sending someone away, like it has not yet reached. It's not yet so much in the African kind of cultures, and we've seen it even ourselves. So most people, as you're saying, because someone is working, maybe they have a business somewhere, they are schooling or something. That's why now you see some of the services we provide, they come in handy, because they help them, such that if you're not there to do it, then can you find someone to do it for you. And then wherever you're working or doing your stuff, you're at peace, knowing that your loved one may not be doing it yourself, but then someone else is doing it for you and ensuring they're comfortable and everything that indeed they're supported with. Yes.
And the best thing is that it's a professional who is taking care of them, which I think should give us the peace of mind, knowing that our loved one is being taken care of. All right, so we need to go for a very short break, but then when we come back, we can talk about then aspects of sedation, and is it right, is it wrong, when do you give a person sedatives and all those things. So if you have any question in relation to the topic, and that is on palliative care, do you have any concerns or any inquiries as far as palliative care is concerned? We're live, so that means you can call in anytime with your question, concern, or inquiry. The number is 0791 478 990, or better yet, send us a text message on 40920. We'll be looking at them after this very short break. Stay with us. All right, welcome back. Glad you're still with us. This is My Doctor, and today we're talking about something that we don't really talk about much, and that is on palliative care and hospice care as well. And of course, like we said when we started the show, this is something that probably is not common in the countries compared to the Western countries because of probably so many reasons. And of course, culture playing a bigger role as far as palliative care is concerned, and people not accessing or seeking the services as far as palliative care is concerned. So if you have any question in relation to the same concern, probably have your loved one who was diagnosed with a terminal illness, and you guys don't really know how to help this person because, again, one person is affected, the family, is affected in general. So then what do you do in case of, such a situation? Well, that is why we are here and we are live. So call in anytime. 0791-478990 is the number to call through, or send us a text message on 40920. We'll be looking at them a little bit later. But for now, let's just address the cases of sedation. And when does this happen? Is it you to determine, or is it the doctor? Because like you said, you work hand in hand with doctors as well. So can we just talk about that? And first of all, what is that and why is it offered?
Okay, when you talk about sedation, we are talking about pain management.
Yes.
And therefore, we use those drugs that we use to relieve symptoms. Symptoms ranging from pain and even stress, anxiety. So those ones are prescribed by the primary doctor of the patient. So on the contrary, sedation is used because usually it is used to relieve symptoms. Yes. Yeah.
And then what determines that? Because you see, when a person is, let's say, in pain, pain is relative in terms of there's some people who are able to manage pain very well and some people who cannot manage pain, even if it's like just small. They want to be able to then handle cases of pain. So then when it comes to offering then the services, because you see, a person might ask for, let's say, some pain relief medication, and really they're not in so much pain that they need medication for the same. So do you check, or if a person asks, you just give them?
Yes, we usually have a PET scale of level 1 to 10, depending on the level of pain, and again, in regard to the staging of the disease. So we usually ask the patient how much pain, in a level of 1 to 10, how much is the pain? How intensive is the pain? That's when we know we can be able to gauge, as a trained palliative care nurses, they're able to gauge the level of pain. So we can, if it is severe pain, severe is around from 6, 7, 8 out of 10. So we can use opioids, the opioid analgesics, that is morphine. Mild pain is between 1 and 2 is mild pain. So we use less, we don't use opioids, less strong analgesics. So we use drugs, pain medications in regard to the level or the scaling of the pain. Yes.
Okay.
Yeah.
And then is it possible to sort of for a person to receive both palliative and hospice care at the same time? Or you have to go through one first and then go through the other later?
Even though we said they have a difference, we can say that all hospice care is palliative care, but not all palliative care is hospice care. So, of course, you see palliative, a patient graduates to hospice care after receiving palliative care. Okay. But then also you can also be receiving palliative care, which can also be considered hospice care. Yes. So you can have palliative care when under hospice care, but you cannot have hospice care and you're going through palliative care. As you see, you are graduating from palliative care to hospice care. As the disease or illness progresses, it becomes more unmanageable, maybe. Yes.
And do we have cases of a person, or probably this I should ask later, but now for palliative care or even hospice, depending again on where the person wants to be, because like we said, there are hospitals which offer palliative and hospice care, but then again for you guys you deal mostly with home care, which I think it's a good thing, because then the family does not feel sort of secluded from their loved one, as compared to, let's say, facilities where there's some limited amount of time that a person can visit, their loved one and all those things. But then again, does it mean that the family has no say as far as care is concerned? Because you see, again, when a family is or family member is going through something, or a friend, sometimes we feel we know best what they need. But then again, when professionals come to play, it might be different because you are a professional, you know what this person needs more as compared to just me, who is a family member, and I love this person and I want to take care of this person, but I might end up not really helping them much. So then when a person seeks palliative care, does it mean that the family has no say?
No,
Okay.
and on the contrary, actually it's the family, that makes the decision.
Okay.
Yes.
Okay.
Yeah,
okay.
with the doctor, with the advice of the doctor. Of course, the major challenge with the palliative care is the cost implications. Because if you look at these diseases, most of them, the family has used finances treating this family
a lot.
So by the time the doctor announces that you have 6 months to live, you've used most of the resources. So that is where the challenge comes in. So that's when the family opts. Can we do palliative care at home, or we send our patient to a facility?
Yeah,
Yes.
but of course there are cost implications, as well.
Yes.
So home care is more affordable as compared to taking them to a
again,
facility.
maybe to add to what he's saying again, when we come now to provide now the care, of course the approach should be, it's a support system, you know, it's a support system that you're offering to the family and those who are involved. Of course, there is not someone that maybe is your relative, or even you've known them, or even known the journey of their lives or the illness. You are just coming in at a certain time to offer assistance to the family. So that should be the approach, not the approach of you're going to work with families. You know, welcome the ideas. You can have a discussion to agree what's best, what's appropriate, what can be done, what cannot be done. So that should be the approach. But then not the thing of say it all kind of an attitude. No.
Yeah.
The family is part and parcel, and mostly the most important stakeholder in the patient.
To work with them as well.
Yeah.
All right, so we'll focus more on the patient, but can we talk about the family a little bit, or the friends, or whatever, let's just say caregivers, who are with this person through it all. I mean, they've seen what this person is going through and want to be there, but then again, they are affected in one way or the other. So can we talk about then the care that is given to the caregivers? Because again, if you do not take care of them, they might not be really there for this person because they're also going through something. So are there like specific things or support that you also give to the caregivers?
Mostly,
anybody can take this.
Yeah, mostly these caregivers are trained. So they are
like family members who are taking care of this person. Yeah,
the family members, as you've said, it's not an easy thing, even for the family. That you've had maybe a parent who has been productive in their lives, they've been okay, they've been working, they've been taking care of you, and all of a sudden they are disabled because of an illness. So even to the family or the people that are close to a patient, it's not an easy process for them. So there is also an important aspect of when you come in, you also need to ensure that there's extended support to them also. And number one major support that we can say the family is offered, number one, is, for example, they are helped in carrying out these duties. Okay. For example, now when you have a nurse go to offer them to offer help to the patient, or even a caregiver, of course you see the duties are lessened for which this person can do. And by doing so, this family member is able to engage in other personal life issues or engagements. So this is to mean that the family member, their life will not stop because of their loved one is sick, or they have to close a business because they have to take care of the person. So that's number one kind of support, which I think is the most important, because they're able to proceed with their normal lives, even if maybe not 100%, but then knowing that they're able to do someone is helping them. So that's important. The other important part, as we had said earlier, is also maybe the aspect of maybe counseling.
I think it's very important as well.
They need to understand maybe the process of this illness, maybe what to expect, for how long maybe this would be, okay? And then we also have some families also form maybe social groups, you know, social group where they can talk, they can discuss issues, they can share ideas and all that. Also, if there are any resources that are useful to share with them about what is being handled, what's being done, it's also an important point of aspect of support towards a family. Yes, and then the other one now, which is now also takes a turn on families, is also maybe the financial aspect of it.
Yes.
Yes, so which like ourselves may not be able to support them financially, but then should there be any avenues maybe from where they work or insurance companies or anything to help them, that's another aspect that a family will need support because to help them in the long term towards taking care of the costs of all this. Yes.
Yeah, because we understand, I mean, by this time that a person is seeking palliative care, of course, like we said earlier, they have exhausted all their finances.
Yes.
And I think the biggest thing for us is letting go, knowing when to let go. Because we really want this person to be okay, but they are suffering. And we've had stories of families, or let's say a person who's going through a condition that they are in so much pain that they tell their loved ones, just let me go. But the people are like, no, we cannot. Not now. We still need you. So then I think we'll talk about then, when do you let go, especially for a family, as much as it's difficult, but to help this person, not for your own sake, but for the sake of this person. But then again, we also talked about an aspect of different levels of care needed. And I've had a person, there was a lady who the parent, I think, was dementic. And it was very difficult. I think that is why I asked the aspect of then, do you offer support to caregivers in terms of counseling and all those things? Because you're saying it got to a point where the parent became so aggressive and very abusive and, you know, and all those things. And see, if you do not understand well, then it's difficult for you, because you'll be like, me, I'm taking care of you, but why are you abusing me? Why are you becoming violent towards me? And not knowing that this person does not even know what they're doing at that time, because she'll be like, the parent will be very violent and very abusive and all those things. And then later on, be nice. So she was confused. She was like, oh, okay, so when do I look forward to the good days and when do I look forward to the bad days? So again, yeah, it can be very difficult. But then again, in terms of the level of care needed, do you have cases where you just go to a family and probably train them on how to take care of this person and then let them do it? Is there such in your organization?
Yes, that's we train them. We train them to take care of this patient. At least usually say at least every caregiver should have a basic knowledge of the condition that their patient is going through, what they expect, how they expect this person to behave. Yeah, like you mentioned, dementia. Dementia ranges from aggressive, sometimes they're elated. So the caregivers should have a knowledge of, they should know what is this person going through, or how to handle them, how to handle dementic patient. Yes, so it is very important to have a basic training on these diseases. Yeah,
because again, there's some people who might not necessarily afford palliative care, and especially at home, to just have someone come over, let's say on a daily basis or once or twice in a week. There's some families who cannot afford that. So if they can get then again basic knowledge so that they know how to deal with this person, when to administer medication and all those things, I think it will be nice.
Yeah.
Yes.
Okay, so then in terms of how long does this last? Because again, like we said, difference between the hospice care, where I mean, this person is in their last days, so of course you want to do the best for them. So 6 months, that's it. But then for palliative care, when or how long does it last?
Palliative care, how long it does last is not definitive.
Okay.
Simply because, as I said, you qualify for it once you've been confirmed you have a life-limiting or life-threatening kind of a condition or illness that needs this kind of care. So we may not like per se say for how long.
For 1 year,
it will depend now with to now be depending on the cause of the disease and how it deteriorates. So you may not like say how long. It will depend now with that specific condition, the progress and how it's managed and for how long.
Yeah.
Yes.
All right.
But then all in all, palliative care is more of a long-term kind of care, because this is a chronic illness that you may not have a definitive or a specific kind of a curative kind of treatment to end it. So what you should know, just like it's like long-term kind of care.
Doesn't have like a specific
long-term kind of care, because the condition is terminal or chronic.
All right. So then, can we talk about what if the symptoms become worse? What does what does a palliative care team do in the event that, yes, you'll be trying to help this person and offer all the kinds of support that is needed, but the symptoms are getting worse? What happens?
Okay, we usually liaise with the doctor in case the patient has developed any other condition in between. So the doctor will refer you to another department of such sickness. So usually we liaise with the doctor, and then is the one who decides. Now these patients need more care. Maybe it is intensive care unit to be admitted in an intensive care center. So usually we don't just work alone.
So the doctor will advise if it gets worse. But if it gets better, let's not focus on the negative. What if the symptoms get better? What happens? Do you get to the point where you say, oh, well, this person is doing well, the family has the knowledge and know-how on how to handle this patient? Do you then say, oh, well, you can take care of it from there, and as we retreat?
Yeah, we can withdraw.
Okay.
If the patient gets better and the family is able, they have someone who can take care of them, we usually withdraw, because again, the financial implications. So if the patient is okay, the life is not at stake, we usually leave them to be comfortable at home, because palliative aims at comforting the family and the patient. That is the most important thing. Yes.
Okay.
Even I think even as we've had sometimes, we have those kind of stories of families. We came in when the patient needed this kind of care. Again, we said the main focus is to improve the quality of life. So if a time comes and then this standard is reached, then you may not maybe to be there, or even if not to be there fully, maybe you can be visiting to check. If they need some support on and off, you can be visiting. But then, as I said, if you get well, then you can lessen or even withdraw fully.
But you don't just wake up in the morning and say, this person is okay as we're going.
It's a process,
it's
because
a process,
we want to ensure that even having left the patient, the support system would continue. Unless they have been confirmed that now they're not ill anymore. But then if maybe the symptoms have lessened, or you might need maybe to keep the support system, even if not 100%. And I like the approach that we're taking. This is not like a treatment facility per se. We're dealing with the symptoms and just ensure that this person is comfortable, not in so much pain, and improving the quality of life. Now let's talk about something that most people don't, and most organizations and facilities don't want to talk about, and that is the cost. Because like we said, this can be really expensive to people. So are there, or do you accept like other forms, like for instance insurance companies and HIF and all those things? Can they, or is it possible for them to cater for the services or to pay for the services that you guys offer, especially if the patient is given like home care, or home services as compared to being taken to a facility? Okay, maybe. Of course, when like now, if you speak now for the home kind of setting, kind of care, of course, if the condition is manageable within the home setting, of course, the cost of managing an illness or care requirements at home are much lower than what you require to be in an institution. And also the cost would also depend on various factors, on what are the requirements. Like we told you, like we have different care plans for different patients. There's someone who need care just for the day only. Another one in day and night, that will mean like 2 people. Other one would need someone to live with them at home. So all these factors are determinant of what cost. So the cost would vary, okay, from very little amount to high amount, and also depending also on what is being treated and what's being handled. We have cases that can be handled by caregivers, you know. We have cases that are handled by licensed nurses. So you cannot compare the two levels of care, which would mean that even the costing would also be different.
Yeah.
Yeah. In Kenya, mostly you'll find that some insurances also, yes, will cater for the cost in the home, but then not for the long term.
Okay.
Not for the long term.
Okay.
Not for the long term. Yes, the majority will take for maybe a month or 2 months.
Okay.
And this mostly after maybe discharge. Okay. And also depending also with the kind of care required at home. But then some insurances will pay, some others won't pay. And also it's an area that also needs to be focused more by insurance companies.
Yeah.
Because it's becoming more and more needful and the society. Because you'll find that majority of Kenyans will pay from their pockets.
Yeah.
Majority will pay from their pockets. But then some insurances will pay.
Will pay.
Yes, yes.
But then again, we have cases of so many Kenyans, I mean, do not have insurance covers. So then I think that's another thing that probably we should explore more. So we have like 2 minutes to go, and we focus more on the conditions and diseases and all those things. But an aspect of disability, and can you talk about some of forms of disabilities that might necessitate one to require cases of palliative care, very briefly, because we have like 2 minutes to go.
Yeah. Some conditions, like the major one, cancer, may cause disability, especially cancer of the spine. Yeah, it affects movement. So this patient may not be able to move. Yeah, there's also dementia. Sometimes it causes, the brain is not able to function like a normal person. Yeah, so those are some of the disabilities.
Okay.
That,
What about like accidents that sometimes might render a person to require cases of palliative care?
Yeah, even accidents. Though accidents, basically the patient lives with this disability for the rest of their lives. They may not die within the next 6 months. Yeah, unless it has affected the spine or the brain.
Okay.
Yes.
All right.
Yeah.
So then as we finish, of course, we talked about earlier on a little bit about the state of palliative care in Kenya. But then again, as professionals and of course as persons dealing with palliative care, very briefly, like 30 seconds, Anthony, then what do you think needs to be done to ensure that people embrace palliative care? Yeah. Very briefly.
With the changing health care in Kenya, I think people need to embrace that there's a new way of, there's a good way of caring for patients.
For their loved one,
and that should you need support, they're able to support you. It's an area that also the government needs to come in and also be able to help and also offer support so that those who are not able to, because our infrastructure, even the healthcare infrastructure, is not able to accommodate everyone.
Yeah.
So if we have programs, even government-oriented, that are supporting people in the home, you'll find that we are improving quality of care and help us even towards achieving of the universal healthcare agenda, even of the government.
Yes.
Yeah, so that's an important factor that we can embrace even as a country.
All right.
Yes.
And of course, on that note, we have to end the show. Thank you very much, gentlemen. Ian Kimathi and of course, Anthony Misheni from GoCare. Really, really appreciate your time and for giving us insights on palliative care. I really hope that from this discussion, then we have a changed perspective as far as palliative care is concerned. And I think my takeaway message is it's okay to seek help.
Yes.
It's okay to seek help. Do not feel that you're not caring for this person or do not feel that you're sort of sending them away. It's okay to seek help so that we ensure that our loved ones get quality of life and of services that will enhance the same. And of course, that is where we have to say goodbye. My name is Winnie Lubembe. Thank you so much for staying with us. Remember, if you missed out on the first part of the discussion or you're tuning in right now, don't worry. You can get the full episode on our YouTube page, and that is on Every TV Kenya. Please make sure that you subscribe to get notifications of all the programs, amazing programs that we have, and that is on Every TV. And follow us on Twitter as well on Every TV Kenya. So see you tomorrow, same time, same place, for another episode of My Doctor. But for now, God bless. Stay safe. Goodbye.